Day 2. Now this is a day where I'm gonna help you get super clear on what you want your surgery to look like. Have you felt stressed at times with the previous surgeries, feeling like maybe you're running out of time or the patient's getting a little bit uncomfortable? Have you been wondering between IV sedation, general anesthesia? If these were just the only things you could stress about, it'd be great. But there's a lot more. So that's why day 2 is all about surgery and handling any complications. But like every other conversation we have, we got to get super clear about where we are currently and where we want to take this process. So surgery is one of those things where it really can be scripted. And so we need to be clear on the front end when the patients come in that we are clear about how that day is going to operate. So first thing is patient's going to arrive, and then what's going to happen? Who's going to be with them? What staff or employees are going to be with them? And we script it out so we know exactly who's responsible for what part of the experience. This is where we're going to talk about our checklists. Checklists are so critical when it comes to surgery. If you ever had to cancel surgery because someone messed up on something, or we failed to get a medical release back, it's really frustrating. So we're going to talk about ICAM 4D and photogrammetry. We're going to talk about our intraoral scanners and how to take records before surgery and during surgery and handling and managing blood and scanning. We'll talk about instrumentation and the setup I use to make this process super efficient. The surgical setups are really critical, and the instruments and even the equipment we use is very different than any other procedures in dentistry. We have an all-in-X surgical table that I'll show to you, that I'll show you how you can recreate or buy if you'd like. We'll talk about smile design. This is so critical that we're clear about what we want the smile to look like, and if this patient is a good candidate for all-in-X. When we start looking at planning the case, we want to look at the CT and make sure the patient has enough room, that we're looking at a prosthetic solution for this patient. It's going to be better what they currently have. We really want to get super clear about whether we're doing a brain-guided surgery or if we're going to do actually a computer or a lab technician-guided surgery. This really can be a step-by-step flawless surgery. We'll talk about some advanced procedures like pterygoid and zygoma procedures. These are procedures I've done quite regularly, but we want to really qualify the patients that we're doing this on. And having the right team, staff, and the patient having the right consents is critical so that we keep ourselves protected as well as the patient. We'll also talk about our post-surgery patient instructions and what we're going to tell the patient and what we're going to tell the family. We have a specific consent that we go over with family members or caretakers to make sure they know exactly what they're going to experience. I don't know if you've ever had this experience where the patient wakes up and they're happy, but the family's not. And it's because we didn't take the time on the front end. Remember that documents appointment before it's that appointment. It's between consultation and surgery. It's so critical that we have this documents review so that we know who's going to be with the patient and what we're going to do with that patient so that they know that it's okay if we're in surgery till 2. And the patient's might be there till 5 o'clock because everyone wakes up a little bit differently. We're going to take the time to get super clear about what that experience is going to be like. We're going to do one more workshop on this day, and it's our smile reveal workshop. And we're going to get you scripted so you know exactly what you're going to do, where you're going to do it, what you're going to do with it, and who's going to be part of it. But capturing the smile reveal is something special. And you'd be doing yourself a huge disservice if you didn't take the time to video some of these amazing transformations. 1, it helps the patient have a special experience they'll never forget. 2, you're actually capturing a moment that could help you in the case of a lawsuit or litigation. 3, you're actually paying yourself and your team with the most important resource, which is emotion. When you see someone look in the mirror for the first time and they start to get emotional, you look at your team and they get emotional, and you look at yourself and you're getting emotional, This is the juice to life, my friends. And so you want to capture those moments. The great thing about it is that when you capture those moments effectively, they become your next marketing material. And what you're doing is creating credibility and becoming a figure within a community where you're trusted. And so it's so critical that this day happens just seamlessly. Surgery really can be something that's not stressful at all. And it can be the least stressful of all the different appointments that you do. But it does take some planning. Now, at the end of this day, we're going to sit down and we're going to talk about complications. From implants going into the sinus, implants going into the nerve. We're going to discuss every single complication that I've experienced, and we talk about how we're going to manage those complications. This is a day that's going to really help you get more comfortable with the overall procedure and what you want it to look like. At the end of the day, you're going to have a lot less questions, a lot more confidence and certainty about what it takes to pull off a perfect, flawless surgery.